I want to bring back the medical panel now. Dr. Devi, Dr. Nesheiwat, Dr. Bose. I'm going to hit something straight up off my Twitter before we get to other questions because it's popping to me. I think it's a good question. If we all have, if we have all of that, deaths, cases with normal flu, why do so many people die every year from it? That's from the Deuce. You know, Dr. Nesheiwat, I know the shot has something to do with it, the flu shot.
Yeah, well, the flu shot and vaccines, for the most part, help save lives. The flu vaccine has helped save thousands of lives every year. Of course, it's not 100% effective, but the flu is a very, it can be a very serious disease for some people, especially if you have underlying medical disease, asthma, COPD, a weakened immune system, if you're a smoker. And it can affect some people that have no health problems as well. We can't control everything and prevent every disease and virus in this country, but we can at least take precautions, same precautions with coronavirus. Keep your hands washed and clean. Don't rub your eyes. Don't rub your nose. Get your vaccine. If you're sick, talk to your doctor because we have medications. That's just part of nature, a part of life that is going to happen until we can get a vaccine that can fully versus 40, 50% be effective, can be, closer to 90 to 100%. And also we need to focus on what's called herd immunity. The more that we can get the population immunized, the less number of deaths that we will have. If, for example, this past flu season, we've had anywhere from, it's estimated 23 to 40,000 deaths. 2 years ago, we had about 80,000 deaths. And of those deaths, majority of them were not vaccinated. Harris, majority of those people were not vaccinated. So that definitely plays a huge role in my opinion.
Yeah, I mean, if people are making the choice not to get the vaccination, you can't really change herd immunity very effectively. And maybe that's the big question about coronavirus too. If one pops onto the market and this comes back every season, how do we know people are going to help build that herd immunity? We don't know. We just know that there's a crisis right now. I thought it was an interesting question. I want to get to this. It came up during the White House Task Force press briefing yesterday, and it was from Dr. Fauci on people of color. Watch.
When you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American populations. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
And of course, Dr. Bose, the president, spoke on that issue too, looking for those commonalities for why people in minority communities fall more often and more tragically to COVID-19. What are you seeing?
Well, from an emergency department point of view, as a fellow of the American College of Emergency Physicians, we treat anyone, anytime, for anything. And when you do look at certain demographics, they do have more challenges. For example, in my personal experience and experience across the country in emergency rooms, African Americans, Latinos have higher rates of certain conditions, diabetes, hypertension, obesity. And there are many social determinants of health. It can be, access to transportation. It can be, if you look at the quality of care, the cost of care, the access to care. And these are things that I'm hopeful, even in the pre-COVID world, this was a problem. So I'm hoping that now in the post-COVID world, we can really tap in on those issues and fix them.
Dr. Devi, we saw this as well with other things that come. We were just talking about influenza, and we have seen this in communities of color as well. I'm curious how we, though, change it during a pandemic. What do we need to do? Governor of New York says he wants more testing in those communities.
Well, I think we have to look at our policies so far and the history of why we might have some of these changes. I mean, if we look at generally, most people watching this pandemic evolve, they're skeptical about different aspects of it, like who knew what when, even starting from China. But if we look at the African American community in particular, they may have even more skepticism about our healthcare system. So the Tuskegee study, for example, that was another infectious disease, syphilis, that was killing people by the 100,000s. And what had happened at that time was the CDC and other researchers and doctors decided to do a study where they looked to see how syphilis evolved. And even when there was a cure, like penicillin, these African Americans who were part of the military, they didn't get it. Instead, the doctors let the people continue to get sick to see what would happen. And the CDC justified it by saying that this was critical research that we needed. So I think a lot of African Americans may be very skeptical seeing all these images of the CDC and these experiments being done. On top of that, if you look at another figure, Henrietta Lacks, where there was an Oprah movie more recently, but she was an African American woman who had cancer, who then went to Johns Hopkins. And we hear a lot about Johns Hopkins just even from the map that we're constantly seeing. But she went to Johns Hopkins for treatment from her cancer doctor, who was also a virologist, ironically. And instead of focusing solely on her care, he actually used her cells to facilitate his research and to make money off of that while she and her family suffered. So I think all of these historical factors are going to play in here, and maybe they're contributing to people seeking treatment at a later stage, not just for coronavirus, but for all of these different conditions. And then I'll just add, in terms of things that we have.
I had not heard this part of the feedback as detailed as you were laying it out. I mean, pre-existing conditions and those things. But Dr. Devi, very interesting.